So good evening, sir. I am Maverick Raven Camilo de Samito, student nurse of University of St. Anthony. And for this procedure, I'm going to perform withdrawing medication from an ampule. So for the preparation, we need to check first the MAR, the medication administration record. We need to check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. So we need to follow the three checks for administering the medication in dose and read the label on the medication. So number one is we need to remember that when it is taken from the medication chart and before withdrawing the medication and after withdrawing the medication. And after that, we need to organize our equipment. So we need an um, ampule medication. We need a 5 cc syringe and a square gauze pad and the other sterile needle that we are going to use. So I'm going now with the procedure. So for the procedure, we need to perform first hand hygiene and observe appropriate infection prevention procedures. So after we perform hand hygiene, we need to prepare the medication ampule for drug withdrawal. So first we get our ampule and we need to flick the upper stem several times so that the solution inside would be on the same spot as the others. Next is we need to have an ampule opener or a piece of sterile gauze or alcohol wipe between your thumb and the ampule neck around the ampule neck, and we need to break the ampule neck. As we can see, the ampule have scored line, so we need to bend this using the gauze pad away from you. So after that, you need to um, place this dispose the upper stem of the ampule. Next is that we need to place the we need to withdraw the medication now. And on withdrawing medication, we need to get the syringe and remove the attached syringe, and we need to get sterile one. So from this ampule, we need to open this syringe, and as per doctor's order, we need to get the proper amount of cc or ml. So it's better if we get more amount than the doctor order because we're still gonna flick it and remove the air from the syringe. So place the ampule, put the syringe, and we need to get the medication. So after that, we put this aside and we need to remove the air. We need to flick to remove the bubbles and to remove the air. So that's how we um, withdraw a medication from an ampule. So remember that we need to place the ampule on the flat surface and hold the ampule slightly, insert the needle and um, dispose of this needle. After that, and we're going to change it with its original syringe in order to give it to our client. So we just need to put our trash into the trash bin, and we do this after so that we prevent ourselves from being pricked by the needle. So we'll put this aside on the medication plate. So again, sir, that would be my return demonstration from withdrawing a medication from an ampule. I am Maverick Ruben Camilo de Samito, student nurse of the University of St. Anthony, and that would be my return demonstration. So there is also another way of withdrawing an medication from an ampule. So the same procedure as from the start, but we need to invert the our ampule. Then we need to insert our needle and gently pull the syringe. So again, we need to prick and remove the air inside. So while removing the air inside, there's leakage that could happen in the bevel of the syringe, but it's totally fine. So after that, that would be the other method, and we need to put it again. Put it on our tray, and remember the other syringe that we, other needle that we left, we're going to change that again, and it's ready for administration for the client. So that would be all. Thank you, sir.